Doctors of Reddit, what's the biggest case of faking it you've ever seen? 30 years old woman came to the ED with such excruciating belly pain, paralyzed, oh god it hurts when you press there, must have oxycodone now. ED doc said if she can get out of the ED bed and do 20 jumping jacks, we can give her the oxy. She did 20 jumping jacks, then got kicked out of the ED. Doctor should get a side gig as a personal trainer. Reminds me of the time one of my patients, let's call him Chuck, claimed to have as allergy to an electric power source. There is a messy situation and he has to testify against an attorney, let's call him Jimmy, that Jimmy tampered with evidence concerning another case. So they're in the courtroom and during cross-examination, Jimmy stands near Chuck, raises the issue of his ES, and asks how close Chuck has to be to an electrical object for his symptoms to be present. He asks Chuck to identify the closest source of electricity and Chuck guesses that Jimmy's trying to trick him, so he asks if Jimmy has something electrical in his pocket. Jimmy reveals that he has his cell phone in his pocket and Chuck calls Jimmy's bluff by correctly guessing that Jimmy has removed the battery. Jimmy then asks Chuck to reach into his own pocket and when Chuck does he pulls out the fully charged battery from Jimmy's phone. Jimmy reveals he had Huel, one of his goons, plant it on Chuck when they bumped into each other on the stairs and though Chuck has been carrying it for an hour and 43 minutes, he has not been affected by his supposed S. Chuck finally loses control and goes on an angry rant about Jimmy's unethical and dishonest behavior. He desperately exhorts the panel to disbar Jimmy but stops in mid-sentence, realizing he has shocked everyone present into stunned silence. Jimmy somberly ends his cross-examination. Was truly a sight to behold. My mom's an ER nurse and she said once some crazy lady came in and complained she had the whooping cough. And whenever she coughed she followed it with a loud whoop. She's doing it wrong. That's a coughing whoop. My cousin got glasses. Her 7-year-old little sister also wanted glasses because she thought it was so cool to wear them. So she started telling her teachers she couldn't read what was on the chalkboard. And she'd squint at home, and go incredibly close to the TV to watch things because she said she couldn't see things clearly. Her parents got worried and took her to the doctor. She read everything wrong on the vision test. Everyone seemed convinced that she needed glasses. But the doctor was a little concerned because the tests indicated she needed really thick glasses, and usually that wasn't the case unless there was a family history of vision issues. Her parents both had 20/20ths vision and her sister only had astigmatism. They all realized she was faking it. So the doctor told her parents in front of her that she'd need some pretty intense eye surgery so she'd be able to see without glasses. They even wheeled in a machine to make it convincing to say they could do the surgery right then and there. She freaked out, confessed to faking it all and started to cry. She got grounded for a while. I remember I faked it when my brother got glasses because I thought they were cool. Turns out I actually needed glasses. They found an astigmatism in my eyes. Who knew? I'm an ICU and ER nurse. We get a lot of malingering in the ER. One day, one of our frequent flyers came in and started faking a seizure in triage. Now obviously I know this lady and she's fake seized a million times before. But this time it's in the lobby in front of about 30 people, who have no way of knowing that it's fake. She's lolling around on the floor making a damn fool of herself and folks look horrified. I walked up to her and said calmly, "Karen, what are you doing?" To which this genius responds, "I'm seizing." I told her to stop seizing. So she did. Oh man. Would love to have seen the face of all those people watching this unfold. Had a patient when I was an intern feigning blindness. She would constantly be playing on her smartphone, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated hello wave. She started to throw her arm up to but caught herself halfway through, then threw her hand back into her lap and pretended to be staring off into nothing. A friend of mine likes to stick out her hand for a handshake when people come in feigning blindness. Nearly all of them instinctively meet her handshake. It's great to watch. When I was a kid I learned I could fake sick and get out of school. So 1 to 2 days a week I would get a migraine and hold my head and complain and I would get to go home. Eventually my parents took me to a neurologist who said maybe you just don't let him eat chocolate and sugar. I admitted to faking and was grounded for a long time. I grew up the opposite way. I would get 3 to 4 migraines a week, but everyone thought I was faking it because most days I seemed fine, just because I was learning how to deal with them and try to act normal. It wasn't until 8 years after they started that I went to a neurologist who said I have chronic migraines, which I dealt with unmedicated for 16 years. Now I'm on medication. I feel like my childhood was wasted. Ophthalmology technician. People pretend to be blind all the time. Go to check their eye pressure with the Tonopin, a device you poke them directly into the eye with, and they go, "What the fuck is that thing?" I have a sort of opposite angle story for this one. A friend of mine is completely blind, as in, eyes removed as a toddler blind. She had a rare cancer. She's worn glass eyes her whole life to keep the sockets from sinking in, as well as to limit the jarring appearance. Well, she had a new doctor she was seeing, so to speak, to get fitted for new glass eyes. I think that was why. When the tech brought her in, they told her they had to examine her eyes. And asked her to read the vision test chart. She kept trying to explain she is blind, and they were stuck on examining her. Whoa, your pupils aren't responding. No shit. She finally got so frustrated, she popped one glass eye out and said, "Here. Now you can check it out all you want." She apparently always would pull that gag on folks doubting her and / or teasing her. She's awesome that way. When I was a kid, I would plan my sick days ahead of time. Had an old thermos that I would pour leftover milk, meat, whatever. Leave it on the windowsill in my bedroom, just letting it fester for a month. Of course the thermos was closed so no smells escaped. I set an alarm for the middle of the night, dumped the contents of the thermos on my rug and ran in to tell my dad I was throwing up and so sick. However, this thermos monstrosity filled the entire condo up with horrible smells, and both me and my dad ended up puking into the tub at the same time every time we tried to clean up the rug. He had to take the day off work too. Needless to say, I never pulled that again. Not a doctor but a nurse once had a patient having a seizure. The other ER nurse and I knew she was faking it. He said as much. She suddenly stopped seizing, miraculously, looked straight at him and yelled, "Shut up, fat boy." He and I laughed so hard. He, the other nurse, was referred to as such, fat boy, for a few months after that. At least she wasn't having a seizure. My mom was an emergency room nurse. Years ago they brought a prisoner from the local pen in who seemed to be unconscious. The guards were suspicious that he was faking it. They checked his vitals and everything seemed to be okay. The attending doctor tried poking him in the foot with something pointy, nothing. Then he got an idea. They took a rubber hose and inserted it in the back of his throat as if they were intubating him. That did the trick. He sat up very quickly, coughing and gagging. Taking trauma call during surgery residency, had a prisoner come in after a fight and claimed he couldn't move or feel his legs. All the CT scans and MRIs were normal, but we would shield his legs so he couldn't see them and poke them with needles and other sharp objects, with enough force to cause pain. He never flinched or moved his legs at all. He was diagnosed with SWRA, spinal cord injury without radiographic abnormality. He stayed in the hospital for a week, no improvement. Always had one guard with him. One night they were down in the lobby watching some television, but the guard needed to use the restroom. The patient said, "Where could I possibly go? I'm paralyzed." Guard left him alone for 2 minutes. Patient last seen sprinting down the road, naked butt cheeks flapping in the breeze. Made it to a city 4 hours away by car before he was caught again. I have never seen anyone fake it so well. Truly playing the long con, taking trauma call during surgery residency. Dermatologist here. Patient was convinced she had a melanoma and needed a biopsy and would need to be on workers' comp. I told her it looked like ink from a marker. She demanded a biopsy. I wiped the area off with an alcohol swab and showed her the ink and that there was no spot on her skin anymore. She stormed out threatening to sue. I'm just glad I cured her melanoma. Thanks for watching. Subscribe.